Okay, I'm going to be doing an intradermal injection, and these are used for TB or skin allergy checks, and they can be done on either of the forearms, the top part of the chest right here, and the top part of the back in between the shoulder blades. For this, I'm going to use a 1 milliliter syringe and vial of TB. And before I start anything, I'm going to check my orders and make sure that there's an order for it. And I looked here and I have an order for a TB shot now. So I'm going to look at my MAR, and in my MAR it says the same thing. They match up, the same medication, the same amount. So I'm going to first wash my hands, and then I'm going to get my medication. I'm going to check it. If it's a multi-use vial, I'm going to make sure if there's a date and time on it. If not, I'm going to make sure when I'm done that I put that on there. I'm going to get my syringe, and my syringe has anywhere between a 26 to 28 gauge needle on it. And I'm going to use 1/10 of a milliliter here. So I pulled that much air into my needle, and I'm going to clean off my vial here with an alcohol wipe. I'm going to inject my air into the vial, and then I'm going to draw up 1/10 of a milliliter. And if I have air bubbles in here, I'm going to take my pen and tap them out here. Take a minute here. Okay. Once I have my medication, I'm going to recap my needle. And then I'm going to actually change my needle. Nope, that did not work. Take this off and put a new clean needle on here and dispose of that one in the sharps. And then I'm going to go down to my patient's room, take my medication with me. I'm going to identify my patient, make sure I have the right patient. Ask for 2 identifiers, name, birth date, and then I'm going to double check my medication again before I give it. Make sure it's 1/10 of a milliliter, which it is. I'm going to wash my hands while I'm explaining the procedure and asking the patient if they've had this done before. And they say they haven't, so I'm going to tell them about the TB shot. And then I'm going to select a site, probably on their forearm here, and I'm going to cleanse it with alcohol. Check with them and make sure they don't have any allergies to anything we're giving them. And then I'm going to let that dry for a second. Probably. Put on my gloves. And then I'm going to use my non-dominant hand to kind of pull the skin a little bit. I'm going to make sure my bevel is up. And I want to insert this at a 5 to 15 degree angle. And I'm going to go just barely underneath the skin, about 1/8 of an inch in. And then I'm going to insert that in. And it should make a little bubble there, right under the surface of the skin. Pull out my needle, recap it, dispose of it in my sharps container, and I can wipe that with alcohol. And then I'm going to draw a circle about 1 inch around the outside of the injection spot. Then I'm going to educate my patient and let them know that if this gets bigger than that circle, they need to come in immediately. Otherwise, it needs to be checked within 48 hours. And if they don't come in within 48 hours, then we need to have them redo the whole procedure. Once I'm finished with the patient, I'm going to go out and I'm going to document. I'm going to record the dose that was given and the site that it was given in, whether it was given in the left or the right arm. That way the nurse that's checking it can make sure that they're checking the right spot.